The special meeting of the House Standing Committee on Health and Family Services. We are here to just hear one bill. I wanted to give members a few minutes to read the bill. That's why we're taking our time here, getting started. So hopefully everyone has had a chance to take a look at this. I will go through section by section to explain the bill, and then, of course, we'll take any questions. But if we could go ahead and call the meeting to order, and Secretary, please take the roll.
Representative Bentley?
Here.
Representative Bowling?
Here in the room.
Thank you. Representative Bray?
Present in the room.
Representative Birch? Thank you. Representative Dotson?
Present.
Representative Elliott? Thank you. Representative Fleming?
Present in the room.
Thank you. Representative Frazier?
Present in the room.
Thank you. Representative Marzian? Thank you. Representative Gibbons-Prunty?
Present in the room.
Thank you. Representative Rayburn?
Present in the room.
Thank you. Representative Raymond? Thank you. Representative Riley?
Present in the room.
Thank you. Representative Sharp?
Present in the room.
Thank you. Representative Sheldon?
Here in the room.
Thank you. Representative Tate? Thank you. Representative Weber? Thank you. Representative Westrom? Thank you. Representative Wilner?
Here in the annex.
Thank you. Chairwoman Mosier?
I'm here in the room.
Thank you.
Thank you. We have established a quorum and are ready to do business. I would just like to remind everyone, if you are on remote, please keep yourself muted until you are speaking, if you don't mind. And please use the chat feature if you have a question, and just notify staff, and we'll put you in the queue for questions. I will be coming to the table to explain a little bit about the bill. What you have in front of you is listed as BR 8. It was just filed, so it is now House Bill 2. And I will hand over the microphone to my co-chair, Representative Prunty.
You may proceed. Introduce yourself for the record and your guests, and proceed.
Thank you, Madam Chair. And I'd like to invite my guests, some of whom are on Zoom, and some of whom are here in the room with me. If they would like to join me at the table, they can. They are really here to answer questions. I am State Representative Kim Mosier from the 64th District. And I am going to discuss today an act relating to COVID-19 emergency actions and declaring an emergency. This is the bill that deals with many of the healthcare issues, as you would expect in this committee. And I know that the bill just went out to some of our members, and we've had a few changes, and so the final draft has just gone out to everyone. So I hope everyone had a chance to look it over, and certainly ask questions if you have any. Sorry, let me find my notes here. So I guess we can just go section by section. Section 1 is something that should be familiar to everyone. It was taken from House Bill 1 last year. It is It was Section 4. It is the section of House Bill 1 that dealt with the essential caregiver, and this would allow nursing facilities to, or the cabinet to implement a framework to allow essential caregivers in nursing facilities. We know that individuals who are residents of long-term care facilities suffered greatly because they didn't have interaction with their family members, and this would allow nursing homes or long-term care facilities to just put this framework in place, allow those individuals to be approved. The family has to decide who the essential caregiver would be, and then the long-term care facility puts policies in place to allow that individual to be one of the compassionate caregivers. We know that our long-term care facilities have suffered nursing shortages and healthcare worker shortages, and so this would also help alleviate some of those stresses on the long-term care facilities. Section 2 would allow the Cabinet for Health and Family Services to assist and support in establishing additional, they are being referred to as the COVID Antibody Administration Centers, CAAC, throughout the Commonwealth, and develop protocols for those. This would allow treatment with monoclonal antibodies, and Regeneron is a medication that you have probably heard about. But further, it would allow anything that becomes FDA approved for this purpose to treat someone and keep them from experiencing the severe symptoms from COVID. This would designate at least one center in an area development district. And so that's why in subsection 2A, it designates that a qualified treatment provider would be permissible in each of the 15 area development districts. Section 3 simply allows the Cabinet for Health and Family Services to assist and support hospitals, licensed healthcare providers, jails, prisons, homeless shelters, and so forth, local health departments, to obtain and acquire sufficient testing, COVID testing. And this is largely already being done, but we wanted to make sure that those entities who need further testing are able to get what they need. Section 4 just directs the Cabinet to promulgate regs in and around sections 2 and 3. Section 5 allows paramedics to be employed by a hospital or a nursing facility to work as a licensed paramedic in the department of any hospital or nursing facility, and they would serve under the direction of doctors, APRNs, and they would need to follow the protocols and be under the supervision of the medical directors at hospitals and so forth. Section 6 just allows the Cabinet for Health and Family Service to partner with any universities, colleges, or healthcare organizations in developing an educational, kind of a public service announcement type educational service regarding COVID-19 and some of the treatment, some of the prevention around vaccines, and just making sure that individuals are getting accurate information about COVID. It talks about some of the partnerships that may be included, and just kind of outlines that it may include individual athletes, coaches, physicians, nurses, and those affiliated with or employed with universities, colleges, and healthcare organizations. Just ensuring that and those would be the messengers, not the folks who necessarily provided the information, but we want to make sure that we are getting accurate information out to folks. Section 7 deals with primary care physicians and some of the smaller healthcare facilities have had difficulty in getting vaccines when they need them. They'll have patients come in for a physical and have conversations, but then won't have the vaccine in their office. And so apparently there was a federal singular form that was making it a little difficult for some of the smaller providers to get those vaccines in their office. And so this directs the cabinet to work with and be a resource to those primary care offices to be able to get vaccines in their office if they want to. And let's see. Section 8 is kind of just clarifies the definition of the state of emergency. Apparently there were two declarations of emergency on a federal level. One came from the president's office and one came from the office of HHS. And so this just makes sure that we know what those are. It just clarifies it. And then later in Section 8, we talk about extending the provisions of House Bill 276. That was a bill that we passed last session that allowed long-term care facilities to hire temporary personal care attendants and have those individuals use those hours that they obtained and apply them to their state registration. And so that helps, again, with the nursing shortage, our healthcare worker shortage. It gets people into the pipeline and creates that pathway into healthcare, which we so desperately need. And the original language stopped with the state of emergency. So once we are lifting the state, or extending rather, the state of emergency, we are just specifically and explicitly saying that this program can continue through the state of emergency. And then Section 9 and 10 are similar, dealing with two separate regulations. The first one is 902 KAR 2.211 emergency, and then 902 KAR 2.212 emergency, dealing with the blanket face covering or mask mandates. And these will, it just explicitly says that these regulations are with the, well, actually it's just nullifying and saying that they are null, void, and unenforceable, and that in Section 8, Section 9, sorry, subgroup 3 or sub number 3, it says it prohibits the governor from promulgating an administrative reg that is identical or substantially the same as the administrative reg referenced in this section. So it just says that these mask mandates, a blanket mask mandate statewide, is not to be considered appropriate, that the local governments, local businesses, and so forth are who should be dealing with mask mandates. And then Section 10 simply states that this act takes effect upon its passage. So I am happy to entertain any questions, and I have Betsy Johnson, I believe, is on Zoom for any long-term care questions. And I have the Hospital Association. I know Nancy Galvani is here with us, and John Inman with the Primary Care Association. So I tried to get some folks here to answer questions specific to each section.
Thank you for the presentation. Questions, Representative Westrom?
Thank you very much. I didn't think you'd get to me so quickly here. In Section 2, I was wondering who selects the provider?
for the infusion
Yes.
or for the administrative center.
Yes.
Those are largely, there are many, many hospitals who are already doing this. And so these are largely taking place in hospitals, but it's not explicitly outlined here. Really, any infusionist would be able to administer this medication. It would still require a doctor's order, and there's specific criteria that needs to be met for the patient to be able to get it. But we didn't specifically outline. I think that the cabinet wanted some leeway in who to partner with, and I know that the secretary is also on Zoom. I don't know if you want to direct your question to the cabinet.
No, I think that's a good answer. I think
Okay.
it gives some independence to different locations and the medical facilities that are supporting this.
Mr. Secretary, are you online?
Yes, we are.
Would you like to comment?
So, this is Eric Friedlander, Secretary of the Cabinet for Health and Family Services, and I have with me Commissioner Stack. And actually, that was very well explained from my perspective.
Okay, thank you.
I do too.
Representative Western, did you have a follow-up?
Yes, I do. The licensed paramedics, are they currently licensed? I wasn't familiar with that.
Yes, I believe so.
Okay. Public service announcements. Is there a fiscal note for that cost?
I believe in the appropriations bill that we'll see, there will be some funds available for that sort of thing, and I believe that that is being left up to the cabinet to decide. But I don't know if the cabinet has that information at this point. It might be too soon, but I don't know if the cabinet wants to comment. I know that a lot of this they are already doing.
Mr. Secretary?
There are funds available for the public campaigns. So yes, there are funds available for this, and we welcome our partners, particularly the universities.
Okay.
Final question?
Final question has to do with the face coverings.
Yes.
So would independent agencies, businesses, would they be the ones who would determine now is the time it's getting scary? Are they the ones who would implement a mask policy?
If they so choose, they can implement their own policy around mask covering or face coverings, and masks, yes.
And I'm sure there would be guidance from the local health departments when they see a rise, they would try to identify what the hot spots would be.
Yes, I'm sure that there are metrics that, they can independently look at and decide for themselves. And, all of this would be in accordance with the CDC guidelines.
Okay. I think that's it. Thank you.
Representative Martin?
Thank you, Madam Chair. So I'm going to kind of follow up with what Representative Westrom said about the monoclonal antibodies. And I get, Mr. Secretary, how much is each infusion? Having worked in a hospital for a long, long time or outpatient, everything you have done is a fortune. You get your bill. And I guess, is that going to be covered by insurance and Medicaid, or how will that work?
Good question.
So this is Stephen Stack, Commissioner for Public Health. The federal government provides the monoclonal antibodies directly and pays for it directly. The cost has been circulated at about $2,500 per dose of monoclonal antibody. But again, the federal government pays for that. The administration costs are billable to insurance. And so if a patient goes and receives these services, they can receive a bill to their insurance company. And most costs are covered first dollar for COVID, but that's not a certainty. So a patient would have to be aware of any potential exposure if they have out-of-pocket obligations with their private insurer.
Could I have,
Yes.
Thank you so much for that. And, it's amazing how much we have been able to offer to the citizens as far as vaccines, COVID tests for free. Is there a ballpark figure that we've spent so far? And I know feds are paying for a bunch of it as well, but do you know? ultimately, it's taxpayers. Do you have a ballpark figure of what we've spent?
Representative Marzian, I would hate to guess at this point. We are going to be able to receive 100% funding for vaccinations for Medicaid. Why don't you let us come back to you with a ballpark on that? Is that all right?
Oh,
There's
absolutely.
so many pieces to put in,
Right.
the testing, the vaccination. I hesitate to make a guess because my guess will probably be too low, and I'd rather come back with something a little more solid for you.
I understand. It's just, you watch it on television all the time about people getting tested, and you can go to this place and it's all free, and nothing is really ever free. It comes down to somebody's got to get paid. And my last question, Madam Chair, on the, and other Madam Chair that gave us, on the distribution to your primary site, is there still a concern with storage and expiration? And I know you said it's not mandatory, they don't have to have it, but is that still an issue, or have the drug companies fixed that?
You know what? I'm going to call on John Inman, who's here with our Kentucky Primary Care
There you go.
folks, and he will be able to directly answer that.
Mr. Inman, can you, introduce yourself for the record? Put your microphone on.
Sorry. John Inman with the Kentucky Primary Care Association. And I'm sorry, I wasn't quite clear on what the question was.
It related to the section that said primary care providers could have doses of the vaccine in their practice.
Mm-hmm.
But I have a concern when it first came out with the storage, and they were saying it had to be like minus 500 degrees and frozen, and if the expiration date, the whole lot of them were expiring in June this year, and would that be